order. First thing on the agenda is public comments. We have 3 folks that signed up for public comments. The first is Brian Denfeld.
Good afternoon. Oh, is it? Is it just, I guess it just where I was speaking to. Interested in helping the homeless, have a few things. The recent death of Garrick Dixon begs the question of how could we as a community have failed this person to the point of death, and what needs to be done to prevent any more deaths. Number one, we need a moratorium on breaking up encampments. In fact, we need a safe place to camp. The CPC doesn't have enough beds for all of the homeless, and some people, like Garrick, couldn't stay in shelters. And the idea of opening overflow shelters at minus 10 degrees is ludicrous. We need to stop acting like the end of the world's going to happen if we build a community with the homeless. And I emphasize community because that's where it all starts, showing decency, kindness, and compassion. The couple of places where I visited where rules are strictly enforced, drug and alcohol rehab is part of the program if needed. These places are in Madison, Occupy Madison, and in Austin at Community First. So let's see, their people have to put in 150 hours work. Building shelters is required to get a shelter, and these are working out great. The first steps is organizing, getting a set of rules to comply with, determining the amount of temp housing in any one area, and there can be more than one area, getting the names of the homeless that want to participate. And we've been talking with Zach, one of the homeless, that said he'd be more than willing to help us with this. From self-organized camps to tiny house villages, give people a chance to prove themselves and get back into society. Let's build on what's working in other areas. Some camps start out with 90 to 180 days trial stays, and then move to a different place if needed within the city. Any place can be on a trial basis. For this winter, Oak Island would serve well for this first camp. Last, we need porta potties for people to use. Show some kindness. Merchants don't want these homeless using theirs, and everyone needs to go. Many places I visited in different cities have public restrooms, so anyone visiting or living there in the community can use them. Thank you for your time.
Thank you, Brian. Next up, we have Carla Joseph.
Hi, my name's Carla Joseph. I volunteer with Marty Bus. We feed the homeless twice a week, Wednesdays and Fridays from 11 to 2 o'clock. We hand out clothing and various things that they need. The reason I'm talking to you today is that I see since you're going to be making recommendations, I see a big need for the need for strategically placed porta potties. Businesses don't want to have a homeless coming into their businesses to use the restroom. And we aren't really leaving them much of a choice. When they get arrested and cited for either disorderly conduct or indecent exposure when they're out relieving themselves, we're not giving them a choice of some place to go. Now, a lot of people don't know this, but when you get arrested for public indecency, that puts you on a sex offender list. The sex offender list is grouped, if you look at state statutes, it's grouped all together. And when that happens, if you're dealing with a landlord, they're not necessarily going to look into the intricate things of what it was. They just see sex offender and then they won't rent to somebody. So we're making it harder for them to get an apartment because of not having porta potties available. It's a human bodily function. Everyone has to do it several times a day. So it's something that is really needed to talk about, whether you build a park kind of porta potty or a facility, or you have porta potties strategically placed so that they can use them. And that's one of the biggest needs that I'm currently seeing. The other thing that I'll just mention briefly, when we always talk about drug addictions, there's a study out of the University of California, Stanford, that shows that drug use can actually, with the homeless, increase, because fentanyl and meth, one makes you less hungry and one makes you warmer. So you're actually promoting, by allowing the homeless problem to continue and to get larger, you're actually promoting drug use when you're trying to do the exact opposite. The other thing is, if you really want to know what recommendations to make for the homeless, a lot of homeless people don't want to come in. They want to keep low profile. So I might suggest a questionnaire. We're on the front lines. We see people all the time. We can have them fill out questionnaires like, what are their needs? What are their biggest problems that they're facing out there? And that might give you a firsthand glimpse of what they're seeing versus from their eyes versus from, us looking from the outside in. Thank you.
Thank you, Carla. Next up, we have Nancy Stencil.
Hello there. My name is Nancy Stencil. I too volunteer at the Marty Bus, and many of us in this community are trying to help. We do what we can, and what we are doing is simply putting a Band-Aid on an issue. Without the stability of food and shelter, first and foremost, people are getting set up to fail. Yesterday we held a vigil for a man who recently died. Yesterday was also Human Rights Day. And the older I get, the more I see this. Human rights is a pretty broad term. Recently, we heard many comments from the community keyboard warriors, which really is what led to having this vigil, on how people deserve this way of life. Or that, he had enough money, he could have helped himself if he wanted to go somewhere. Well, I ask them if this ignorance makes them feel superior. I know many alcoholics and many drug addicts too, and the only difference between the ones that I know is that they can hide it behind closed doors. Please learn from models from other communities. There's many of them, Chippewa Falls for one, that's had a good amount of success with this, like a tiny home village where, case management can meet people where they're at. And when you're struggling to survive, cross-town appointments suddenly are not the highest priority in your life, or how do you get there? So let's remove the barriers as best as we can. Thank you.
Thank you, Nancy. Next on the agenda are committee discussions and possible actions. I know we reviewed the task force charter last meeting. And then we asked for a definition of homelessness, and I think Supervisor Conway had sent one. I thought it was really good. I don't know if everybody had a chance to take a look at that. I think it had 4 different pillars of homelessness in that description, which covered almost everything that you could think of for homelessness. So if you haven't taken a look at that, please take a look at that. Did everybody get the emails on that? I want to make sure everybody's getting those. Okay. Okay. Next on the agenda are review local data applicable to homelessness, including but not limited to capacity, reasons for turnaways, services offered and services turned away, and success rate for setting people up in homes. And today we have Tracy here that could help present some data.
I
Yes?
am definitely here. I can answer any questions.
You have to use them.
So sorry. Hello? Okay. I can definitely answer any questions related to the data that you have all received. I get my data monthly, actually daily, from Good Shepherd Shelter, which is formerly Catholic Charities, the Warming Center. They are the only shelter currently in Wausau that shelters individual adult males and females. We do have other really great resources in our community. I entered that into the report as well, but this is the only shelter currently that our unhoused have to access on any given evening. I do want to clarify one point, that the Community on Call initiative is activated when temperatures are 10 degrees below zero. And I know that's a very cold threshold. I understand that. But we are trying to do some capacity building at the same time. And so right now that is the parameter we use. Madison actually uses 15 below zero. So on any given night when the temperature is 15 degrees or lower, Catholic Charities does open up 10 additional beds, and they go into what they call overflow. So they have the capacity to shelter up to 40 people on those nights. So I just wanted to clarify that because I feel like I heard something that maybe wasn't completely accurate there. So in terms of data, what I can tell you, and I think what sticks out as really important to me is just the numbers that are coming into our community that are new homeless individuals. And to date, as of January through October, Catholic Charities reported 124 brand new, never been to shelter, unhoused individuals. That's a big number when we're already looking at hundreds to begin with. So as you navigate through how the county and city are going to work together, I would also just let you know that that number is increasing, and it's due to a number of different reasons. I would say, and this might be a point for Matt and I to talk about to you, is that I don't always encounter the same unhoused individuals that the police department encounter. So there may be a higher number of individuals that are coming here from other counties, other cities that I have not had contact with that some of our officers have. So to my best knowledge, I would say that 20% of the people that I come in contact with are from other communities, other counties, and the majority of our homeless population are Marathon County residents. Did they always reside in Marathon County? No, but they've been here long enough now to become and be counted as a Marathon County resident.
Tracy, if I could interrupt for a
Yes.
second. I think Administrator Leonard's trying to get the presentation up on the screen here, and he looks like he did.
Okay.
Do you have a specific page you want me to go to? Just
I honestly am here just to answer questions that you all have regarding the data. Like I said, I get this data every single day from Catholic Charities. I report on this monthly to the Public Health and Safety Committee meeting. So I'm happy to report to this committee that the numbers you have in front of you are direct numbers from Catholic Charities, not numbers that I've produced. So again, any questions you have related to the data that I've already submitted, that would be great. I can tell you that in the work that I have done, I have housed over 60 individuals that were formerly homeless. And I will tell you, one of the easiest things sometimes is getting them housed. One of the hardest things to do is to keep them housed. And I'm sure Beth Ann from Judicare can tell you there's probably a ton of mediation going on. And Diane with North Central Cap, I mean, we try. We try to get people housed, but unfortunately, sometimes the way that they are navigating through life is they lose day-to-day skills on how to make it on their own. And so without wraparound services and case management included into that plan, sometimes we're seeing some failure. And I am confident that my success rate is about 75%, which is decent. But we're all trying really hard to navigate through this. And, you know, that's just what I have to say at this
Thank
point
you.
about that.
I think Chief Barnes has a comment or question.
Yeah, just kind of some observations in reviewing that data, and if you have anything you want to add to it, I think that would be helpful for the group. One is how the warming center or the shelter operates in regards to bed safes. So you'll see data in there that was really telling to me because it speaks to what percentage of those individuals on a particular day are employed. And I think if I'm the average citizen of Wausau, I would be surprised at the percentage of the individuals seeking shelter that have jobs. And that impacts the amount of shelter, that space that's available on a particular day, because per the policies of Catholic Charities, if you are employed, you can let them know, I have a job, and they will save a bed for you. So it's like automatic shelter for the night. And then there's what remains, and then a population of individuals show up, and there's a bit of a lottery based on, if they have 20 spots and 20 people show up, everybody gets a bed. But if 30 people show up and they have 20 spots, there's a bit of a lottery. So there's no guarantee that that's there. And I know a piece of data, I'm not sure if it was in there as I reflect on that approximately a third of the residents are female, that if we look at the total census data for Catholic Charities. And then it's really bizarre, and maybe you have it in my mind, that maybe you have some explanation for when you look at that data, maybe if you go toward the end, Lance, where it does it day by day. We see days with 9, 10, 11 turnaways, and then the next week there's 5 days in a row that they're not at capacity. And so trying to understand like what those, why?
So yeah, I can help explain some of that. So just to go back to your point about employment, Catholic Charities reported that to me a little bit later, so you don't see that reporting starting January of last year. But I can tell you, I just got November's data too, and about 22% of the population, or about 19 guests on average, were employed. So again, to Matt's point, what they will do is they will save on any given night. I think the median number of people is like 6 a night. They'll save 6 beds for individuals that are coming to shelter after work. So already you've got 6 beds less before the doors even open, right? Which is great that they do that. It allows people to get rest and to get their job and things like that. So that's fantastic. Some of the reasons why people aren't seeking shelter on a regular basis, there's a number of them, but a lot of people that are unhoused receive SSDI or SSI. So the trend that we kind of see, especially with one of our local hotels, is at the beginning of the month, a lot of individuals aren't in shelter because they're using their disability checks to check into hotel rooms. So your numbers are going to fluctuate throughout the month because people are utilizing their monthly income to go to hotels because they can do whatever they want in a hotel room, and they can get adequate sleep, and they can take a shower and get a free breakfast, I think, in the morning. So so that's one of the reasons. Another reason is because there are drug and alcohol issues and addiction issues that play a huge role in someone not wanting to shelter completely for a full night. If they're starting to come down from their high or whatever their situation is, they can't stay in shelter because they need that next high. They need that next fix. So that situation is not ideal for them. And you can't use drugs in the shelter. You can't drink in the shelter. So some people decide to leave or not come at all for those reasons. And there's probably a multitude. I could sit here for probably 3 hours and talk about that. But I think the numbers, though, are going to always fluctuate due to some of those reasons.
And I just think I'll hand you this one. I think my only other observation when I look at it, I cross my eyes a little bit and trying to look at the whole thing through that type of lens, is the demand for emergency shelter in Wausau. The supply does not meet the demand the majority of the time. Like there are one-off days or 3 or 4 days where instead of 30 people, they're at 28, 29. But there's enough days when there's 7 or 8 people turned away that supply does not meet demand here. Correct. And I mean, at the end of the day, that's what we want the data is to be like, what's the need and what's the supply in regards to recommendations we may or may not make.
Thank you. Tracy, what you said, you have a 75% success rate, which is excellent. But once they're housed, they have difficulty because of the lifestyles they've developed. So you said there's no case management, there's no wraparound services. So what do we do to get these people into case management? And the other thing, we talk about, I was just looking at the Catholic Charities statistics and the turnaway rate between January and May and July and September. It wasn't a daily kind of thing. It was monthly, and those turnaway rates were excessive. So when we have this data and we know that we need case management and we know that we need programs, where do we look to have that handled? Is that a county responsibility? Is that just the social services responsibility? Where do we go to have those things implemented? Because it feels like they do. I know there is a facility, we talk about housing, I know there's a facility that the county owns that it has been brought up for transitional housing, the dormitories at UW, and the feedback I've gotten is that it's unsafe. And I said, well, why is it unsafe? And they said, well, there's asbestos in there. In the real estate industry, you learn that asbestos is very expensive if you have to remove it, if you have to haul it away, but asbestos can be encapsulated. So is that the only reason that those dormitories are unsafe? I think those are legitimate questions that we need answers to, because that really looks like a great place to me, not having been through it or knowing the issues. But why isn't that an option? And what can we do about case management?
So I don't think that I am necessary. Matt, you can correct me, but I don't think that I should be here to share my opinion. But I will say that there are agencies that provide case management. North Central Healthcare has their outpatient programming that provides case management. North Central Community Action Program provides case management through their housing programs. CW Solutions provides case management through their housing programs. Most of what people are eligible for and engage in is all voluntary. We cannot make people accept case management. So the first thing is we have some of those resources. Do we have enough? Probably not, but people have to want to do it. Just like people have to want to go to rehab and treatment to get their drug and alcohol addictions under control. There's nothing that we can do. We could build a facility 3 times what North Central is and have an inpatient unit, right? But not all the people that are unhoused are going to take advantage of that because some just aren't ready. And so for the case management piece, I think there's no surprise we need more of it, but we have it, and it's a voluntary service that people have to want. In terms of the building, I am not going there. You can talk to Lance about
what I'd
that.
like to do is kind of stick to our agenda for today.
Yeah.
If we want to talk about housing, we can put that on the agenda for a future meeting. I think that's a good topic to do. But right now, if we could, when I talked about the DMAIC process, following the DMAIC process, when you define a problem, you measure it, right? Today, I think we're in the measuring phase and gathering that data on the measurements that Tracy provided. I think it's really good data to understand the problem. And then I think the next meeting we can analyze it, right? We can analyze the data and tell us what we think it means and where we need to go. So that's when you get into the improved stage, like housing, right? So I think, if Becky's okay with it, we took a look at the capacity, right? We know that there are days when there's overcapacity or undercapacity. So we know there's that variation depending on the days, like Chief Barnes had mentioned, 5 days in a row, right, where there was capacity issues, right? So I think, go ahead, Becky, here.
I guess that when we talk about capacity, that's only the people seeking shelter at that time. I don't think it's narrowed down to there's like 5 or 6 underserved people then on that day. Those are just people seeking shelter that were turned away. Many know that it's at capacity and doesn't go or whatever. I think I'd like to circle back in when we're talking right now about numbers and data, is the number that you gave about 124 newcomers. I think that is a pinch point that we need to not gloss over. If that continues, Tracy, have you and I don't want to put you on the spot, so if you can't answer, but do you have any idea why they're showing up? Who's bringing them? I mean, I don't think they're walking to Marathon County.
I think Matt can answer that.
Yeah, I mean, so the answer is there's more than one way that people are getting here. And I'm going to make one observation that, Lance and Tracy and we were involved in an email correspondence trying to collect data on what percentage of the homeless in our community are from here and which ones have migrated here or recent that are seeking services. And there is no, I can't log onto a website and be like, what's the answer to that question specifically? So we look anecdotally at our experiences with it. So Tracy's like, Matt, I think it's 20% that aren't from here. And when I talk to our staff that are out on the road and I ask that same question, they say 40 to 50% of the unhoused that they're dealing with have recently moved to Wausau or were delivered here. And so I would ask everyone to think about why might that be? Well, the individuals we're dealing with that we're called to, they're behaving in a way that is either a violation of the law or creating a disturbance. And then we do a little history checking on them and where they came from. They had burned every bridge and the police were dealing with them on a regular basis. Those services were no longer available to them there. And then they were brought to Wausau to kind of start that process all over again. So it makes sense to me that our officers are being called to scenes on a much more frequent basis than Tracy's interacting with them. So through our experience with the average patrol officer, it's 40 to 50% of those they're dealing with don't have ties to Marathon County or Wausau. How do they get here? I know of family members that care about their family member that's homeless and realize all the resources that bridge has been burned where they're from, and they transport them here to hope that they have a better chance at success or receiving services. Unfortunately, we have other state agencies that we've had to contact and say, do not transport people to Wausau and just drop them off here and hope for the best. If there's a reason and a connection to services and an opportunity for them to be successful here, that's a different story. But these are, how'd you get here? I got a ride here from someone who gets paid with tax money and they're living in Marathon Park. That's not okay. We have other police departments who are frustrated with people that are in difficult circumstances, mental health issues, unmedicated mental health issues. They have burned bridges. And so it is easy to be like, want to go to Wausau? And then squad cars from other jurisdictions are, at 2 o'clock in the morning, under the cover of darkness, they're dropping off unmedicated schizophrenic people at the Quick Trip on Grand Avenue. We see that on a regular basis, and I've asked our officers to let me know every time they see that. And so in an 8-day period, we had 3 individuals from Stevens Point that made their way here inappropriately, and in our opinion, and we're not connected with services, and they weren't welcome in Stevens Point based on their behavior, and then they came up here and were behaving in the exact same manner. And so that's why our officers are dealing with them. So we have organizations that are trying to help. We have local and state organizations and families. And we also have a word of mouth that, hey, somebody that came here calls the people that they know, they have phones, and they say, Wausau's not so bad. And we have people that are like the same way I might move up north, to enjoy the Northwoods. They're like, well, I just moved to Wausau and I made my way here because, look, you guys have a warming center. You have a food pantry. You have someplace you can go get food during the day. Here are these resources that are here, and I want those resources, so we made our way here. And that's what we've experienced, and I'm sure there's a couple. I think that answers your question, but that's what we're seeing.
Thank you. Go ahead, Bill.
I was wondering, because I pulled the community care balance of state data for migration, and it's way different than that. Do you know why that might be?
So the balance of state uses a system and Diane can also speak to this, called Clarity. So any agency that is a balance of state participant uses Clarity to enter in their data. Not every organization in the city of Wausau has access to that same system. So we don't have a centralized master list of unhoused that we can all access. So our numbers are going to look differently. And you know, depending on staffing levels that even some of the agencies that are in the balance of state, sometimes that data isn't getting in, you know, in a timely fashion, or maybe it's not getting in for a bit longer than it should. So those numbers are always going to look a little bit differently because of that fact.
Because that has it down, it's like 15% migratory, but it shows where they come from and where they go to. Because there's actually a little bit more leaving than coming for the last 12 months. So.
I want to clarify just a couple numbers, make sure they came out clear. First of all, in community on call, it's 15 degrees above zero that the Catholic Charities goes from 30 to 40. Mm-hmm. And then when the minus 15 is wind, minus 10 is wind chill, not actual temperature. So I just want to make sure people are aware of that. And then the final number, the 120 first timers, 124, thank you. I just want to confirm that that's not necessarily people from out of town. That's just new people coming to the shelter. So some could be new people from coming out of town, but others could be residents that are falling into the homeless from ours. So we do an informal data point at our outreach center where we ask the people who come in, where did you stay last night? And, you know, you have some that have stayed at a shelter, some that have stayed outside in a park or under the bridge, but there's a large percentage of those that are at a hotel and running out of money, that are temporarily on somebody's couch. So that is very often feeding that number of new people coming. And the final thing I want to say, just from our experience as a ministry, and Matt and I have talked about the people being delivered. That is true. But we have the people we end up sheltering and housing and working with, a lot of them came to town not to be homeless because of homeless services. They came to town because some kind of a relationship with another person. And very often it's Aunt so-and-so, or it's hope of this job, or it's something like that. And then they come to town and then something happens and they end up, you know, needing the services in the housing community. So I just wanted to clarify that that is happening, which is different than people being delivered or coming here because we have services. So that is a very real situation. And obviously then we should be very concerned about those and make sure our services are available for them.
Yeah, thank you, Craig. Go ahead, Terry.
I don't know. I had a medical appointment about a week and a half ago, and the doctor told me where she knew I was on council, so she brought up the homeless issue, of course. And she said she's from a surrounding community city, and she said, we have people from Wausau coming to our city. And so I don't think that is just a local problem. I think that people from various communities might be migrating as well. It's not minimizing this problem, but it sounds like it is happening to other communities also. So I guess the question becomes, what do people do when they don't have services any longer? And what comes to my mind is people like Tracy who are helping, but then the services are either limited or they don't have adequate options. So I guess they have to do something. That's just my feeling.
So two things to that. One, it wouldn't be me if I didn't say I'd like to see what those communities are in their populations, because that hasn't been our experience, that we're seeing an exodus from Wausau to other surrounding communities around here. But I think there's a data point that's not necessarily on here, but it's really relevant, and that is we have a portion of our homeless population, and it's a minority portion, who their behavior when they're receiving services causes them to no longer be appropriate to receive those services. So when you have a single point of emergency shelter and that individual's behavior, for whatever the reason, it could be a mental health issue, it could be intoxication, it could be just having a bad day, causes you to get a strike or to be expelled, then there's a period of time that they are no longer welcome there. And then, to your point, what does a person do when the only game in town is no longer, you can't get tickets to it? And so I think that is a real question that there's not necessarily an answer to, because the only answer at that point is during community on call, kind of the bans don't necessarily apply. They figure out ways to shelter those individuals. Or there have been times where, then it's a hotel because that's the only option. But that's putting people up in a hotel here at the cost of a hotel isn't sustainable either. So, I don't know the answer to your question, but I think it's a fair question, and we deal with that on a regular basis.
Thank you. One of the things that I would like to bring up on our agenda is, and maybe Diane, Craig, or Tracy can talk a little bit about, is the reasons for turnaways. I know there's some data in there, if you want to talk a little bit about that, and you guys might have the most contact with turnaways.
Sure. So my experience with Catholic Charities is they're turning away people primarily due to capacity. They will turn somebody away if they've been given a strike and they're trying to, present for shelter that night. But the majority, I would say almost all of the turnaways for Catholic Charities is due to capacity. When the Salvation Army was sheltering adults, their assessment of people and their turnaway rate was very different. It looked very different. So if somebody presented to Salvation Army that had a bad criminal history, they were turned away. If they were a sex offender, they were turned away because that's a family shelter as well, so to protect the children. Sometimes it was supervisor or management that made the call on that, and sometimes it was just due to behavior. So they had multiple different tools that they assessed when they turned people away at the Salvation Army. But Catholic Charities, as a rule, is due to capacity.
Okay. Do you see that too at Bridge Street Mission? Same thing?
We're not operating an emergency shelter. Our day center, there's really no questions asked as long as they can function without being a risk to the other people who are there. And obviously, we don't have active alcohol use or active drug use in that. In our shelter is a transformational shelter, transitional housing in a sense, so that in that situation, those people are saying, I want to make a change. I want to move out of this lifestyle, and we want help. And so they commit to a much more structured program. And in that, then at that point, we do regular sobriety checks and then other things. And so sometimes folks come in with us for a while and they want it initially, and then they start struggling and maybe they leave. And most of those that we end up having to leave have to do with mental health issues or addiction issues that they just they just weren't ready to change, and we were able to help. And so there's some of that back and forth. And we also do bring them back in after a certain time if they're willing to do that. So there is somewhat times a pattern of someone trying to make a recovery that they fall and then they come back and then use that second time. They go much farther in their recovery. Sometimes there's even a third time, and then they come back and they finally make it, and then you finally have the victory. So that happens, and I think we just need to understand that and realize that it's hard to overcome some of these things. It's hard for them, and it's hard for us that are trying to help them.
Okay. Thank you. Any other comments on turnaways? Questions? Go ahead, Beth.
I guess I'm really trying to wrap my head around why I would assume, from my experience in housing a lot of unwanted guests from the times of Catholic Charities and the Salvation Army at Ranlin Homes. That's where we housed a lot of people who were unwanted by these other places. We still had a turn away. Salvation Army was turning away. The warming center was turning away. The numbers seemed higher then than what you're presenting right now. So I guess longitudinally, like, is the problem similar now than it was 5 years ago? Is it more? Because it seems like we have significantly less shelter now than we did pre-pandemic, but that the turnaway rate is the same.
Mm-hmm.
I feel like I'm missing something. Like, that's not actually true. What I just said is not actually true.
I think it is true. And here's why. So we do have a lot of resources out there. My agency alone has, in the last 5 years, put in place permanent supportive housing. It's not permanent housing. It is long-term housing to help people recover. So at that time, there was 20 people chronically homeless in Wausau, according to the shelters in place at that time. And Ranlin Home was one of those places. So I said, okay, I'm going to do 10 units. That's half the problem solved, and was really excited. The problem is with permanent supportive housing or any HUD housing, it's housing first. So we can get people in housing, and we can't make them take services. And so I want to talk to what Tracy said with case management. There's a lot of case management services out there with a lot of agencies. We still can't make people take those services, no matter what. You know, there's free will. So we always are going to have failures. And that's unfortunate. We don't like to see it, but we can't make people do things. And certainly in our program, because it's a HUD program, we cannot make them go to counseling. We can't make them get drug treatment. We can't make them do anything once they're housed. And we find the housing for them. I sign the lease. I insure the properties. We fix a lot of properties. And people lose their housing because our landlords don't want them there anymore. So then we have to evict them. And I can tell you, I've probably housed 10 people 3 times. And now they're out in the street because they've ruined their chances. And I don't know what to do about that. I mean, you'd think after a while they would learn, and sometimes people do. I'm not saying they don't, but it's a problem. So I'm hoping that HUD somewhere along the way changes their mind. Housing first, yes, and then housing second, housing third, meaning after like 3 months of housing, it's time where they have to go to drug treatment or they have to go to counseling. They have to address their barriers. And for those folks who have mental health issues and people who can't live on their own, and we see a lot of that, we need more group homes. Because people can't necessarily function on their own. When we say we want to keep people housed, sometimes it's not case management. Sometimes they need services that, like in a group home, in a setting where there's constant supervision, for lack of a better word. It's not. It doesn't have to be tight supervision, but somebody there to make sure they eat properly, they bathe properly, that they have activities that are helpful to them. They don't. There's just a lot of things that this community probably could have, and it would help people. But I think group homes are one of those things. I'm not saying transitional housing isn't a need either, but that also is very expensive to staff and to build or renovate. I just don't. I just want you to know that that it is a problem. We all care. And we're doing our best, but free will really plays into this a lot.
Yeah, Diane, thank you. That's a perfect lead-in for the next agenda item, services offered versus services turned away. Now, I know Vicki has a lot of experience in services available, but I don't know if she has any experience in the services that were turned away. So I don't know, Vicki, if you want to explain a little bit about services offered, at the county level at least.
Sure. Excuse me. So I'm what North Central Healthcare offers in particular. And then, of course, we have other private clinics that will offer other services as well. but we are the only one that offers the 24/7 crisis services, where we have our crisis center, where people can present by themselves, family members can bring them, or law enforcement may bring them as well. So these will be people that are in some type of active crisis, needing some assistance. And so at that point, it really depends on how they're presenting and what's happening with them. And for people who truly are and can be determined in general to be a danger to themselves or others, I mean, there can be something that they can have an emergency detainment, and this can be something that, again, is now not voluntary, right? That's a very small percentage of people, because that bar is very high, as it should be, because their rights are taken away for a period of time. So there is that category that we would work with law enforcement and then eventually through the courts to be able to make that happen. And somebody could be under a mental health commitment. Again, that's a very small percentage of the population. Then the majority of the people, it's about working with them to find a safe plan. What is it that we can do to help you stabilize, using natural supports if are available, using any supports that we might have through North Central Healthcare. That can include our crisis stabilization facility that we have for adults. We have one for youth as well, but right now I think we're focusing more on adults. That's voluntary. So people would decide whether or not they would like to be there. It's a 16-bed unit where they can stay for a period of time in order basically to stabilize, to get to the point where they can move to their next situation. So we have some people who are unhoused who access that service. The majority of people who access this are probably not unhoused. I don't have statistics, but we definitely have a variety of people who avail themselves to that service. So again, it's voluntary. People can leave anytime they want, but they are working with professionals and receiving support, group activities, different things like that to try to help them, and also then a discharge plan so that they can be successful once they return to the community. We cannot be the housing specialists at our agency. That is not what we do, but we are connecting people to those services, and so that is where we are making that bridge happen. And then we also have our 28-day medically monitored treatment facility, which is Lakeside Recovery, for those people who are in wanting to rehabilitate or wanting to receive services for their substance use. That is a program that, again, has been reopened since January and is really quite full with residents from Marathon, Lincoln, and Langley County, only open to those 3 counties. Again, it's voluntary. People need to be at a level of sobriety where they can voluntarily sign themselves in when they come and be able to, again, follow rules, that type of thing. There's active treatment every day with substance use counselors and therapists, and lots of activities that occur. People graduate from that program successfully, go on to other things. Some people don't graduate, they leave. They're not willing to or able to at that time finish treatment, and it has been talked about. We do have people come back and enter again and perhaps stay longer, that type of thing. So for people to come back more than one time is not that unusual. We also then have our outpatient services where we can step people down, in particular from any of our other services that we're talking about. So they would receive mental health or substance use counseling, outpatient treatment, and we also have psychiatry services for people who have mental health issues who then can receive medication and therapy services through psychiatry. Those are all voluntary services that people would need to access. Now, we work a lot with the criminal justice population as well. So while we say it's voluntary, in some cases they have incentives to do that so that they are able to not go through the complete court process, avoid jail, that type of thing. So they can make some choice. Do they want to be in treatment at this point, or if there's going to be a different consequence? So it's a level of voluntariness, I guess I would say, at some point. But at the end of the day, they do have a choice whether they're participating or not. We also operate a couple of sober living homes. That is not our book of business, to be really quite frank with you, but we do operate a home for Marathon County and then a home for Langley County. But again, that's not our major book of business because it's not really a treatment facility. It's where people are living and they need to be in treatment and they need to be either working to get a job or some type of education to kind of move themselves on. So that's our other big piece. And I think I covered everything that probably would connect to these services that we're talking about. But at the end of the day, the majority of our, I'm sorry, community treatment. How can I forget that one? Yes, that's major. That's major. Yes, I'm sorry. So that's, again, our other part with outpatient is considered our community care. So people who are either have mental health issues or, again, substance use can receive case management through our community treatment program, voluntary. Now, when I say voluntary in that program, we have people who work with us who, they have periods of up and down, stability and instability, and they might kick their case manager out one day. That doesn't mean their case manager is not going to come back again and try. They're used to needing to engage people and continue to work with people over time. So we do have a number of people that we are working with who are unhoused or at the risk of being unhoused as well. And us working with them is probably helping to stop that from happening. So that's really part of why I'm interested in when we talk about the continuum of what we're going to define here as the scope of what we're talking about for the unhoused population. I think that's really important for us to identify what is going to be our focus area because it's very broad from everything that we're talking about today. So that community treatment, again, is a great program, very intensive case management. People can stay on case management for years if they want to and if they are eligible for it. And then also we have people who are able to, with their own natural resources, don't need us anymore, and that's great as well. There's an employment program through our community treatment as well for people. So it's really getting people to the point where they can accept services, and other people here have already talked about some of those pieces being in place. People having some stability in their life for their basic needs to be able to be ready to deal with some of the other things is in general what's really needed.
Yeah, thank you very much, Vicki. That's really helpful. I know that a lot of us had questions on the services that were available, so that's a good list of services. I think that it covers a lot of things. Any comments on services turned away? Maybe.
Vicki, can you address, like we kind of did with the shelters, capacity and turn away when it comes to your programs?
Sure. I would say we don't use the term turn away, honestly. But if people decline our services, it's mostly because they're declining. Our capacity of our hospital is 16 beds. Our adult crisis stabilization is 16 beds, as well as our lakeside recovery. And so we at times are at capacity and are not able to take people, but honestly, for the most part, we are able to. And sometimes for example, they want to go into treatment or they need to go into the 28-day treatment. If we don't have a bed quite yet, they may go into the adult crisis stabilization for a few days and wait for that. So we try to work with them about what their options would be. People even can stay at the crisis center itself for several hours, not quite like, getting into the days kind of thing, but we work with them on what their options can be, or if they have a safe and appropriate individual to stay with while they're waiting for treatment. So it's really, we always look at what our continuum is. So I would say it's more rare that we're turning people away because we don't have the bed or the capacity than it is people declining service. And one of the issues, and we've had this with our community partners, many discussions about this, is people will say they want service when they're talking to somebody, and they probably mean it in the moment because somebody cares about them and say, yes, I'm ready for service. And somebody may drive the person over to our building, and then when we talk with them about what it really means, they're like, no, that I don't want to do this, right? And so we have to give them the informed choice and explain what the service is going to be about. And again, people may decline at that point simply because they're not ready. It's not the time. So,
any more comments?
I don't provide case management or any of those services, but one of my observations in 25 years of taking people to the healthcare center is that whether it's AODA treatment or treating mental illness or whatever crisis you're in, or rehabbing a broken ankle or whatever the case might be, like, it's a lot of work and it's hard. And so, I just want that to be a component of this. Like, we we are asking people who are struggling and who need these services to partake in something. And I just want to reinforce, outside of us taking someone's freedom away and taking them because they're in a crisis, which is the minority, absolute minority of people using services there, it's all voluntary. And everybody there has the ability at any moment to be like, I'm done. And so I think we see that a lot where, to the point you made, I want help. Yep, I agree, let's fix this. And like, it's great for half hour because they really truly mean it. But actually following through, not necessarily that day, but the day after and the day after and the day after, and doing the work necessary to progress through those treatments. The success rate in that, like through my lens, like isn't great because the person that needs to do the hardest work is the individual that needs the help, not all the individuals providing that. So it's my 2 cents.
Yeah, thank you. Really good stuff here. I think the last thing on our agenda are success rate for setting people up in homes, and I think Tracy touched on it a little bit. Was it 75% success rate?
My personal, in the work that I
Thank you.
sorry. In the work that I do, I would say that my success rate is about 75%. I can't speak to, Diane's agency or anyone else in the room, but, and with that number, I will say, it is a level of case management that I must provide in order to keep them housed. And that's really the hardest part of this job. Meeting with people and getting their story and asking them what they need for services, and even finding a landlord sometimes is the easy part. But keeping them housed is truly the hardest part. And I never put someone in housing with the idea that I want them to fail. But there's individuals that I am touching like weekly, touch basing with weekly, sometimes a couple, 2 or 3 times a week that have been housed for a year already that still require constant interaction and constant services provided by me because they trust me, right? Obviously the problem with that is I'm only one person. So it's difficult to be able to do that with all of the clients that are housed. And so some of the failures come in that reason, right? They
Maybe
really
if you
need it.
just worked harder.
Oh, right.
No, I'm just kidding. But can you clarify your statistic? Because 75% is of the individuals that you have housed, 75% remain housed,
Correct.
right? But of all the people you encounter and engage who are in need of housing, what percentage of them are willing to do the things necessary that you're able, like have the resources to be able to be housed? Like that's a smaller number, right?
Very small.
Okay.
Yes. And sometimes, to be very honest about that, and I'm sure others in the room that provide services like Vicki was just talking about, sometimes it requires me meeting with them several times before they truly are ready for a change. And even then, they struggle. So it really, it's tough work. It just is.
Yeah, thank you. Go ahead, Bill.
I'm a big fan. Here's a question for you, though. Because you can't do it all yourself. Northern Valley, we have Amy. We've got one just like you. Not as good as you. Why are you a city employee for the police department? Why are you not with the healthcare center where you'd have access to, not really an army, but you'd have access to case managers that can support your work?
So I'm going to let Matt answer that question, but I can answer some of that question. So when I meet with clients, I'm not putting in place a plan for them. They're telling me what they want. Okay. And so sometimes we're starting with conversations like, I'm interested in getting my IDs, recovered because I lost my wallet. Okay. We start there. And then it's okay. Well, I'm looking at employment. And then, by the 5th meeting, maybe we're ready for housing. And then I start in on conversations about, okay, what supports do you think you're going to need once you're in your housing? So, I've noticed that you're taking medication because I'm a nurse by trade. So like one of the things I always ask people is, what medication are you taking? What's your medical condition? Do you have a primary care doctor? All those types of things. So once I start really engaging with them and really find out what their plan is, I start engaging them in other services. So I will introduce North Central Healthcare's outpatient case management. I will introduce the ADRC, the Aging and Disability Resource Center, who can deal with people that has physical disability, would then refer them to Inclusa or Lakeland for services. So I am doing that in my day-to-day work now. If I was housed at North Central Healthcare, I don't know that I would have any more access than I do now to get them into case management faster. Right? I mean, is that accurate?
Would or you would not?
Would
did you
not.
say?
I mean,
Probably not.
right.
Yeah, because you're doing the referrals right now.
Mhm.
Yeah.
But you're working with the county folks all the time.
I am. I'm working with everybody in this room pretty much all the time.
I mean, you're, not to put a point on it, but you're a social worker, not a cop. Why are you?
Correct.
I mean, do you want, I mean, I'll give you the answer
Yes,
to that
please
question.
do.
I think it's pretty simple, right? That one of the impetus for this whole group to get together that involves city council members, city employees, county board members, members of the public, is because the county has not been engaged in this street level work. Like, we saw a need as a city. We would hear, not from anyone in this room, but we would hear, like, that's a city problem. Okay, so this is the result. Like, part of the purpose of this group is to determine, like, where are the best places to have resources, what resources are necessary, and who should be responsible for providing the oversight. I have said many times, Tracy's awesome. I will hear people say, you know what the city needs? They need 7 more Tracy's. And I say, you're right, except they're not going to work at the police department. Because we're not a social organization, we're not a human service organization, we're a police department, and it's not our primary focus. We were the only entity at that time who was the point dealing with the issues in our community. We didn't have, officers didn't have the ability when they were dealing with people to be like, let me help you get where you need to go. So we had a need, and we articulated that need to our elected officials and asked them to fund it. And we said, here's who we're going to hire. And we hired Tracy, and she's been doing great. But you will get no argument from me that in the ideal state, this isn't a core function of a police department. A police department should be in partnership and collaborating with what's going on there. Now, I would argue that Tracy has instant access to the officers who are dealing with people on the street that call her up and say, hey, come over here. And we have gotten people assistance in a much faster fashion than I would ever imagine it occurring if this service were housed in its own department or at North Central Healthcare or at Social Services. Like, if that's where you're thinking, like, it's not as fast and as efficient and as effective as walking over to Tracy's desk saying, hey, Tracy, let me introduce you to so-and-so. So it's been successful
Keep her
for us.
office there. That's fine.
Yeah,
but I get your point.
Yeah. So at the end of the day, it was nobody else was doing it, and we saw a need, and we needed the need done now, and we didn't have 6 months or a year or 2 years to have discussion and collaboration and debate over where should this be and who should pay for it.
Because the county is, responsible for mental health, AODA, all the things that she's doing. So I'm sure there's plenty of county cheapskates, but I think it seems to be we should be the ones paying her, not you. I guess. Surprise.
That's why you're on the task force, Bill. I think Administrator Leonard has some points on the county level.
I don't know if I'm the county cheapskate. And I wouldn't be myself if I didn't argue a little bit with Matt and characterize things a little differently. We would go way back. But as it relates to the item on your agenda about services offered versus services turned away, I think Matt is 100% right. The idea of this task force, at least as it was drafted by some eminently reasonable people, is to kind of figure out where are the roles. And the short answer, I will tell you, I don't think any county in the state or any city has very clear, this is city, this is county. We are set up in a unique way. Marathon County, there is nothing in the statutes that I've seen when you talk about mandates for county government that say housing. We are the housing department. We have a lot of services that we offer that interact with people who are suffering from housing instability. The one program I would say that is specifically designed that we offer direct service only available to an individual that's homeless is through social services, and that is we'll receive your mail. We will take your mail. Everything else in my mind is when an individual is accessing, just like North Central. If I have a mental health, on the mandated service list, if I have a mental health condition that whether it's crisis or I want to access outpatient counseling, anything else that makes me eligible for those things, my housing status has no impact on whether or not I'm eligible. It is absolutely a factor in my ability to access it, right? We all live in reality. The fact that I may be, if I'm unhoused, makes accessing services, to the points that were made before, it's hard. It's hard if you're housed to do all these things. It's a lot harder, I presume, having never been homeless, to access them when you're unhoused. I won't go through all the county services where we do interact with individuals who are unhoused, but there are a lot. I gave a summary presentation to the city council a number of months ago. I think it was in July. But I went through, just at a high level, all the departments where we engage with individuals in the work that we do, where we engage with individuals, we have occasion to interact with individuals who are unhoused. And that's everything from on the kind of deep end, where it's a great deal of work. Our drug court is a great example. When individuals come into drug court, very often their housing, they might not be truly unhoused, but their housing that they have access to is not appropriate. We provide that. We partner with Diane on a whole lot of housing initiatives. From when we have people leaving the jail without stable housing, we interact with North Central CAP. We are not mandated to say, hey, you're leaving the jail, let us set you up with housing for the next 6 months. But we recognize that housing is important. How can we try to do something better than, here's the stuff you came in with, good night and good luck? We work with them through social services when we are working with families, because mandated services for counties, one example, we might have to place children in a non-parent situation, place them in the care of someone else for a variety of reasons, and housing barriers, safe, suitable housing is sometimes one of those factors. Well, we work with Diane. We started, we're one of 3 counties in the state, our Family Keys project, to take that barrier away and provide that. So we do a lot of things where, hey, we're trying to work with you in drug court. You don't have appropriate housing. Let's tackle your housing problem. But to your specific question, Supervisor Conway, about where is the housing department, one doesn't exist. But I mean, like, whose role is it? Whose role is county housing? Why isn't Tracy a county employee? Well, because there's nothing mandating saying, this is a county role. That's why I think it's really good, this data collection. And at the end of the day, I'll do whatever, just like at the city. I mean, your department heads will do what the city council tasks them to do. Same thing is true on the county side. Partnering together, figuring out kind of how are we going to work through this challenge, I think is absolutely what this task force is going to hopefully give some good recommendations. La Crosse County is in the state of Wisconsin. La Crosse County and the city of La Crosse have certainly, I would say they're further along in this discovery process. I think they've made a fair number of, I think they would tell you this, they've made a fair number of mistakes that I hope we don't make. But there's just not anything in the statutes, as I see it, where when you look through the mandated program list, which the county board gets each and every year through our budget process, hey, you have to work to provide housing. The state of Wisconsin's set up differently. Certainly Diane's organization does a lot with housing. There's a lot of nonprofits that are engaged in this space, as Craig is just one representative of many, but I think that's the challenge, which is why the task force exists. But how do you figure out where it's going to go?
Yeah, we're not mandated to have parks either.
True.
But that seems to me the work she's doing meshes better with the social services aspect. No?
I can't, I don't know that I'd say better. It's been my experience. Where someone, to your earlier point, where someone's office is or whose name is on their paycheck has zero impact, zero determination on whether or not a system is effective. The system and how it's set up and how people work together and the relationships do. Tracy's great because Tracy's great. Let's figure out where it goes, and then of course it's the funding piece. But if you have there are other states, I know Matt has some experience he can share, but there's a lot of places where nonprofits are the true heavy lift, and they are here too. You know, what's happening between Catholic Charities, you talk about Craig and Bridge Street and the others. There are other states where that's the lift. There are other options where, hey, there's a significant more government involvement, and also governments can contract with nonprofits, and governments can deliver it directly. I'm sure there are shelters, and whether they're emergency shelters, transitional living, that are government run, whether it's county, city, regional. I mean, the way we're set up here, we just have to figure out what's going to work. But I mean, I don't have a great answer for why Tracy's not a county employee. The other part is we have our deflection unit now through the DA's office, where they're out through a grant that used to be with North Central, and we transitioned it to the district attorney's office, engaging the population that would otherwise bump into the criminal justice system, that have the primarily it's substance abuse and mental health treatment needs, to, hey, how do we get you into services? And they drive 4 hours to take someone to inpatient treatment if a bed's available.
So I think it's important, like, if I just want to go back to B1 capacity, we have focused on emergency shelter, keeping people warm or housed at night. What we haven't discussed, it's super simple, is we have 2 or 3, Bridge Street Mission is an example of transformational transitional housing for men in this community, right? So, and they are faith-based organizations that have some criteria to be in place. But when we look at capacity for transitional housing, Tracy's taking people right out of emergency shelter with all the issues that they have that had them in emergency shelter and placing them in a home. And that's the transition. Like, to me, that's trying to jump the gorge. And you got my body, so you made it 8 feet and down you go. And so there's a capacity issue for transitional supportive housing that lead to this success. So, you know, like, if you look at Bridge Street Mission, you have an individual that might be in emergency shelter and seeking or sleeping outdoors, and then they go into a train, and they don't all start at the top tier, right, within your organization. Like, there's a progression that occurs. And when we talk about capacity, I am not aware of currently, as of today, a transitional or transformational program, housing program for women in Marathon County as a whole. So I just think it's important that, like, when we talk about capacity, our whole focus was on where are you sleeping tonight in emergency shelter. But when we're talking about housing and how to have that that flow where we can manage our population, because you entered homelessness and we have a process to get you out, there's very little capacity for the number that we were talking about numbers, very little capacity for that process that leads them to be for long-term success. So sorry, I interrupted Becky.
I guess just to end, I want to talk about mandated versus what we do as a city. We're not mandated at the city of Wausau at any means to provide any of these services. That's not why I'm here, and I hope that's not what the task force is here for, to speak about mandated services and what we have to do. This task force was put together to try to work together to find out how best we can combine resources, don't duplicate resources, find the gaps, and make some progress. The city hired Tracy out of sheer need. It wasn't, let's add an employee because we are flush with cash. We're not. And we have put in millions into this homeless situation that is always lost with the keyboard warriors, as somebody said. It's always lost. There was not a 365-day shelter before the city stepped in to fund it. It stopped in April 1st of every year. I'm not touting the city's done everything, but we certainly were mandated for none of that. We heard there's a need to try to assist. We got a community resource. We made this up. That's what we did. We made it up. We're trying to work on this situation. So the city needs help, period. We need assistance. Marathon County is a big, big county. I appreciate everyone here at this table because we need every one of you. We're not asking one person to lift more than another, but how can we work together with our resources? And I know the county isn't flush, just like the city isn't flush. But I think if we work together, we can make a better lift. We can work with and partner with our resources, our nonprofits. We have those at the table. We have our, NCHC. I love your CCS program. It's very, very, very successful. How can we key people into this? What we can't do is this, we are not making any traction with this. This issue is getting worse instead of better. However they come, they're here. We need to get them help. We need to, and that is what I hear from people I serve, that we just want people to have the best help that they can, and that we aren't going to have people under the bridge and encampments and everything dying there, because that is no place for a human to live. So that is the reason why Tracy's with the police, because we don't have a social service department. And I was asked that as human resource chair, and it's like, I have no other place to put her. She certainly isn't going to go with assessment or DPW. So that is why we did it with the police. But I don't want to get stuck into what we absolutely have to give, and that's it, because we have to do a bigger lift and work together.
Yeah, thank you, Co-Chair. That's a great lead-in to our next meeting, which is the analyze phase of the meeting. So we have a really great data that we presented today. If everybody could comb over that and take a look at that for the next meeting where we analyze that data. And then the next step after that is the improvement. So we analyze the data, we come up with some really good ideas on improvements, and then we present those improvements at the following meeting. Does that make sense? Any questions, comments, closing comments?
Motion to adjourn.
We have a motion to adjourn. Do we have a second? We have a second. Any comments? Seeing no comments, all in favor? Aye. Aye. Opposed? Motion passed. Thank you.
No, that's okay. We're going to analyze it. Ron said.
But when I thought